Time to head to the Fox 11 Fieldhouse. The following segment is sponsored by Aurora BayCare Medical Center. Here's Benny Peterson. Hi, Benny.
We are here this morning with Dr. John Awowale, an orthopedic surgeon who is fellowship trained in sports medicine at Aurora BayCare. Now, Dr. Awowale, today we are talking about common sports-related knee injuries, and what do you see athletes experiencing the most?
Yeah, well, knee injuries can vary depending on the age of the athlete and the sport they play. We see patients that come in from contact injuries as well as non-contact injuries. These can stem from meniscal injuries to cartilage damage. They can also have ligamentous injuries such as ACLs or PCL injuries. They can also dislocate their kneecap, or even in severe cases have a dislocation of the entire knee joint itself. There's also overuse type injuries that we see from time to time. That's usually in our endurance athletes or some of our older patients, and those can be stress fractures or other soft tissue problems such as tendonitis.
And we often hear about ACL injuries, but how does someone tear their MCL or meniscus, and what treatment options are available?
Yeah, so the MCL is usually injured in a contact to the outside of the knee, which basically causes a knock-knee stress on the knee itself, kind of stressing the MCL on the inside of the knee. That's usually treated non-operatively with a brace. In terms of the meniscal injury, that can be due to rotational force or shear force on the knee, as well as deep bending, and it can also be in combination with an ACL injury at the same time. So some people will have an ACL rupture and a meniscal injury, and we can treat those both simultaneously. Patients that experience these meniscal tears will sometimes notice swelling in their knee. They can have joint line tenderness. They can also notice clicking, sometimes catching or locking when they take their knee through a full range of motion. But those are usually treated either with a trimming of the meniscus, which is called a partial meniscectomy, or in some cases we'll repair the meniscus to try to get it healed.
And how about recovery from these sports-related knee injuries, and how do you get patients back to what they love?
Yeah, for MCL injuries, as I mentioned before, it's usually a non-operative treatment. Sometimes we will operate if it's in conjunction with other injuries around the knee, but we usually treat them in a brace for about 4 to 8 weeks, sometimes sooner if it's a less severe MCL injury. And then in terms of a meniscal injury, you know, depending on whether we repair it or we just trim the little piece out that's torn, it can be weeks to months in the recovery. And then in some rare cases, we'll actually do a meniscal transplant, which involves putting another meniscus in someone's knee, and that's only if the meniscus is not functioning appropriately. That's only in the case to kind of preserve the joint and make sure that someone doesn't develop arthritis down the road.
All right, thank you, Dr. Awowale. Now, for more information on Aurora BayCare specialized orthopedic teams, head to aurorabaycare.com/ortho. And Good Day, Wisconsin. We'll be right back.